Alright, Brian, have you heard about the case in Oregon where 2,400 patients may have been exposed to HIV and hepatitis due to an anesthesiologist's carelessness?
Man, no.
Okay, so the story goes along like this. 2,400 patients at a hospital around Portland, Oregon may have been exposed to hepatitis B and C as well as HIV. And this is due to the anesthesiologists who alleged failed to have an infection protocol and proper care. And this happened between the 2017 to 2023, so it's more recent.
Oh, wow.
Yeah, and it's been going on for multiple years. Patients that have been affected are currently encouraged to go and get blood tests, and luckily nobody has been fallen ill yet. But you have a lot of people that have already been infected with hepatitis C and B, and also have HIV now.
Okay, the thoughts that are in my head, that are racing in my head as you said that story is just wow. And this could create an epidemic because if these people are intimate or say someone got cut and
or donate blood.
Yeah, I mean, hopefully they would test it for, HIV, hepatitis, and all that other stuff. But that's sad. That hospital needs to be sued. That person who did that, they should be jailed. Like, how do you not go through proper protocols?
You're endangering everybody's health.
Not just those people, but the public. The people travel. Just like everyone thought C-19 would just stay where it was originating and it spread across the globe. And hepatitis is highly contagious, isn't it?
Yeah, hepatitis C is really contagious and B. But also, it's just like this. People just don't understand how diseases work. Because remember back in like early 2020, people are like, oh, it's C-19 was in Wuhan. It's going to stay in Wuhan. Well, people are so ignorant they don't understand people travel.
You're right.
People travel in planes. And planes are nothing but, metal death traps where barely any air that's circulating in the whole entire vents. And China's a hub. It's a transport hub. People fly in and out of there every day.
Mm-hmm.
And if you go to an airport, congratulations, you contact with a lot of people going in a lot of different directions.
Right. That's just, ooh, man.
But that's just scary, especially if you know that guy was your physician.
Right.
But this is why hospitals have standards of cleaning and biohazards and etc. Because you're not supposed to use the same needle twice. You're supposed to always disinfect everything. That's why in doctors case, that is the most cleanest profession when it comes to tools.
Right.
Because after every use, wipe it down. Alcohol, severe alcohol. If it gets stained with something, you throw it away, you get another one.
That's just
You don't use the same hospital gown twice. You always in a cold temperature. And plus, if your uniform gets dirty, you swap it out with a new one.
I'm just in disbelief, to be honest with you. Just in disbelief. Like, I couldn't imagine, you thought, you went in for a routine procedure and you could possibly be walking out with hepatitis or HIV. This is why people have trust issues when it comes to the medical field. And this is why everybody's not meant for these jobs. And I can't stand when people get into jobs that they should be, mindful and they should care about and they should do their best, and they do shit like this, and it puts everybody at risk. Because just because this is happening in Oregon doesn't mean they can't spread elsewhere, because like you said, people travel, people get on planes, trains, cars, and one of these people could be like, oh, I'm coming out of Kentucky, and they're infected, and not even knowing that they're infected. So I just hate stuff like this.
Overall, if you're in a medical practice, if you dislike it, or if you're not really willing to go through the safety standards, please fucking quit your job, go to a regular